Dr. Jamie Taweel, internal medicine specialist, Grand River Medical Associates. You're like our doctor. Good morning.
Good morning. How are you?
I always learn something when you're on the show. So thank you for taking time because we know how busy you are.
No problem at all. I'm glad you do. Glad someone does.
No, a lot of people do. So obviously, let's start off with the governor's press conference yesterday. It was about the flu, urging everyone to get the vaccine. I guess my question would be, if we're already socially distancing and washing our hands and wearing our mask to try to protect us from COVID-19, would that protect us from the flu as well?
It will definitely reduce your risk of getting the flu. So if there's concern that the social distancing, the mask wearing absolutely will improve your risks of not getting the flu. But at the same time, if there is a vaccine available, I'm always going to recommend that it gets taken care of. I think the biggest nightmare would be to get the flu and COVID-19. You get that 1-2 punch, that might be significantly bad. So.
Yeah, I believe some of the numbers she put out yesterday, about 740,000 people a year hospitalized due to the flu. 62,000 people died. I think it was from October 2019 to April 2020. We know the flu is out there, and I think a lot of times we forget that the flu can be deadly as well. Should people be panicking as we go into flu season on top of COVID?
Well, I would never advocate for panic, so please don't panic. I think as long as we can take the best precautions that we can reduce the amount of anxiety that's out there. The one thing that people often do is when they compare COVID to the flu, they compare flu deaths versus COVID deaths. But what they're not doing is they're not realizing that they're two separate things. So the deaths from COVID are not what's the word I'm looking for? They're not going to take the place of flu deaths. They're going to be in addition to, there's a separate thing. So you got to be cautious with that. I think that the good thing about having a flu vaccine is that it does reduce your risk for flu, so that when you are getting vaccinated and you're exercising those precautions, I think that the panic that's out there should be mitigated a bit, and everybody will feel a lot better about things. I hope I'm making sense with all of this. In other words, the flu is something that we are prepared for. And at the same time, we also have the vaccine to hopefully reduce the amount of infections. And I think that's gonna definitely, and I think COVID's also brought some awareness out there. I've had more patients ask for flu vaccines this year than I ever have before. So I think this is gonna be of benefit.
You are making sense. I'm one of those people that needles scare me. So I will admit I've never had the flu vaccine. For people like me, should this be the year that we actually get it, though?
I'm going to take it one step further and say every year should be the year you get it. I know people have their thoughts on vaccines, but as a medical professional, and I look at the data, I always think that every single person should be able to get vaccinated if they can. I also respect the patient's right. If they do not want the vaccine, I'm not going to be a bully, and I'm not going to argue with them. People are adults and are capable of making their own decisions, and I certainly am going to try my hardest to give them my point of view, but I'm always going to recommend strongly that you stay up to date on all appropriate immunizations, not only for yourself, but for the better of the community.
So Dr. Taweel, on that note, you mentioned that you're getting more people inquiring about getting their flu shot this year with all the circumstances that we're under. In terms of other vaccinations, we've seen in the past few months that there have been concerns that people have not been going back to the doctors and getting updated on their latest vaccines, particularly kids, and now with them returning to school. What's your update on that front? Are people going back and starting to catch up on some of those vaccinations that maybe they missed in the earlier portions of the pandemic?
Well, I don't see children in my practice, so unfortunately I'm not 100% up to date on whether or not kids are asking for vaccines or not. I do adult medicine primarily. But I think, from March till now, I think people that are going to see their pediatricians are getting the appropriate vaccines as necessary. I think, vaccines are essentially given at certain milestones in your life. And I think that patients, specifically children, are getting those vaccinations. And I don't think that there's a schedule that they have to hit that they're going to miss when they go to, that they're going to miss for school next year, if that makes any sense at all.
So, can we talk mask for a moment? We've had you on and we've talked about this at great length. So, I just saw, I believe it was on one of the morning shows, the Today Show or something, where they did a story about the different various types of mask and which ones are better, which ones aren't. And we do know there is a difference. We do know an N95 is going to protect you more than just a cloth mask. One thing that they did show is, the neck scarves, the gaiters that everyone's wearing, which I will say that's what I wear because it's easy to put it on and then it's always with you. You don't say, oh, I forgot it and run back to the car and things of that nature. But they were saying that some of them are basically 0% effective. I was surprised by that because I thought it was just cover your nose and your mouth with at least something.
Well, again, with masks, you want to make sure that you're trying to restrict the amount of, like, for example, whenever you breathe, you're going to have that plume of breath that plume of breath that comes out, and that's what causes that spread. So what you want in a mask is to try and contain that as much as possible. And really that exhalation that you're doing with that air is going to kind of be contained within your immediate person so that a 6-foot social distance will work wonders. As opposed to someone, just think of it as audio. Like if you're screaming, everyone around you can hear you, but if you're muffled, you have to get much closer in order to be able to hear somebody, if that comparison holds any water. So I think those masks that are really, really thin are more or less just kind of calming you down from a visual perspective. But, if you can blow a candle out that's, immediately in front of you, then you're able to project that breath, you're able to project that potential for COVID-19 spread, and it's going to be something that's going to be a little bit damaging. So you'd want to try to do something a little bit more thicker, but again, anything is going to work. If I'm always going to recommend the best mask you could possibly get, but if you're going to get someone who's going to refuse at all costs to get a mask that's going to clamp on their ears and cause them discomfort, make them feel restricted, and if those little masks are a little bit better, it's negligible, but I would just want you to wear something. I don't want people to not wear anything.
Something's better than nothing. And I will say I'm a girl too, so they're cuter, some of them. I'm sorry, I'm a girl.
I'm not going to recommend it. I'm always going to recommend the good masks. But if you're a person that's just absolutely not going to wear one, if that's the only thing you're willing to do, then I'll take it over nothing.
So as we head back into school, we're starting to see these outbreaks. What are your thoughts on that? I know that you're a medical professional, not an educator. This is such a hard time for parents to kind of make this decision. Should they send their kids back? And we're also hearing now more about herd immunity. Should it be that the people that are quarantined are the ones that are in the higher risk groups that are autoimmune deficient maybe, and the rest of us should go out and live life because of herd immunity?
Tough one.
I don't mean to put you on the spot there, and we don't want to get political. It's just there's so much different information out there. I think it's hard for people to navigate this world when there's so much information and it's changing so often.
So here's where it comes from. When you're a hammer, everything looks like a nail. And what I mean by that is I'm a medical professional, so ultimately I'm always looking at it in terms of what's best for the patient, period. And I kind of tend to ignore all of the other things. Not intentionally, but it's just, I'm focused in on what I'm focused in on. So when it comes to, if people always ask me, reopening schools, is that a good idea? In my opinion, until we get a vaccine, if we waited this long, let's just stretch this a little more. I would love to be able to get a vaccine first and try to avoid as much infection as possible. So, but I also realize that is completely difficult for a lot of this world to accommodate. And I'm not ignorant to that fact, but at the same time, my opinion is basically going to be from my point of view. So, you ask a parent that's, a family that's both working and can't take their kids to a daycare, and, it's going to obviously be a more impactful recommendation that's going to frustrate people. I think the video schooling, works really well, but at the same time, I'm always going to recommend, just because of who I am and what I want patients to have the best opportunity to avoid getting infected. So I'm going to recommend that they, we're going to get that bump. And as long as we're aware that that's going to happen and we're trying our best to reduce those risks, I think trying to wait until a vaccine comes out might be the best play. But again, my recommendations aren't always the most convenient.
Well, it's about safety, right? Dr. Jamie Taweel, internal medicine specialist, Grand River Medical Associates. You're like our expert doctor. So tell us, what are you seeing in your office right now? Who's coming in? What are they experiencing? And what should we look out for?
So I'm getting I'm getting a backlog of all the physicals I couldn't get when things were a little bit crazy. So, everybody that's getting those insurance physicals, I'm doing a lot of those. In terms of, I have a lot of patients that are getting their typical colds, allergies are kicking in high gear right around this point in time. So everybody's scared that they might be getting COVID. So I'm seeing we're doing a lot of testing. The rapid testing isn't as happening as much. The lab that I'm using is trying to stretch out a little bit more. So we're trying our hardest to get everybody evaluated. I had a patient who's a nurse at a local hospital. And she says she's starting to see a lot more cases coming in all of a sudden. It's starting to blip up a little bit. I mean, when I say a lot more, I'm meaning like 5 or 6, not 30 or 40. But it's blipping up a little bit. And I think that's just because people are starting to get a little bit more relaxed. And I am seeing that. I'm seeing a lot of more relaxed people. They're wearing the masks. They're doing what they're supposed to do. They're complaining about it, and I am too. But they're doing what they're supposed to do, and I think people are starting to feel a little more comfortable. I remember back in March when there was just this air of uncertainty around the world, and it was just a scary time. It was really scary, and it's going to stick with me for a while. And I think it's going to stick with a lot of people. But at the same time, we're starting to get used to it a little bit more. I think a little bit more confidence in the world is coming back. People are starting to go out. We are seeing an uptick in cases, but I think that we're getting better at it. So I think I'm just starting to see things go back to normal. To answer your question, ultimately, long answer to a short question. I'm seeing things kind of trending back to normal with a little bit of more heightened awareness that their symptoms might be COVID related.
Yeah, I will say even in the beginning, everything you touched, you were so worried and you were constantly thinking, oh my God, I could have got it there or there or there. You become so aware of all the surfaces that you do touch. And so you were constantly washing your hands and using hand sanitizer. Now we've become more comfortable with that. But I will say it is allergy season, like you mentioned. And every time you get a sneeze or runny nose, how do you know the difference between allergies and it could be the onset of COVID? I mean, if we're just a regular person, is it that if you're a person who normally gets allergies during this time, then it's probably allergies?
Yeah, I mean there's a saying in medicine that common things are common. So if it's more likely to be what it is than something a little bit more insidious. However, there's always the risk that COVID is out there. I remember when COVID first hit, we were wiping down grocery bags as we were getting, you know what I mean? But now we're not doing that as much. So there is a chance that it can spread. What would people know themselves. I often have patients that come in and tell me what they already have. They're like, oh, this is my sinuses. It happens every year at exactly this time. Give me what I need, blah, blah, blah. And that, that works out well. But if for patients that are having a really hard time trying to figure out whether or not this is something simple or COVID, I think your biggest giveaway is going to be a fever. If you're having a fever, that's usually the big, not the ultimate sign, but that's something that's really telling. People that get sinus infections don't spike these super high fevers, but people with viral infections tend to. So if you're feeling achy, also remember that infections do just that, infect one particular area. In other words, if you have a throat infection or, a pharyngitis, it's going to just get the throat. Or if you have a sinus infection, it's just in the sinuses. Or pneumonia, it's just going to be in the lungs. A virus isn't really like that. It's actually an entire body thing. So you tend to feel it more head to toe. So you're going to get, fevers, you're going to get achy, you're going to feel fatigued, you're going to feel, sore throat and difficulty breathing, sinuses and, throat. A lot of that tends to just kind of be more of a whole body thing. And that's where the fever tends to kick in as well. So I think if it's something a little more specific, like it's just, I'm just having a hard time with, my stomach only, not to say that it can't be a virus. People do respond to things differently, but it's more often than not a specific issue to that specific area. And COVID tends to hit you from all angles. From head to toe, you tend to just feel miserable.
So, Dr. Taweel with us on the Oakland County MegaCast. Just a couple more minutes with you. Anything that you want people to know, to look out for, other than the typical things we've been saying for the past 6 months? And I do want to ask you, too, it's so hard right now to find some of these supplies, Lysol. I have not been able to find Lysol or even the off-brand for weeks on end. In those cases, what should we be using instead?
Washing. Traditional old-fashioned soap and water. Wash your hands.
But I can't spray down the chairs in the office and the door handles and everything with
bleach wipes. And believe it or not, regular just cleanse around surfaces will help as well. I mean, disinfectant sprays are meant to be so you don't have to clean them. You just disinfect them. You Lysol it. But if you're using a regular traditional like wiping with soap and water, that will also really help with that. So I mean, it's less convenient, but just as effective. I mean, it's not going to kill every germ out there, but it is going to improve your chances. So if you are unable to get those types of disinfectant cleaners, traditional things are going to have to be your best option.
Dr. Jamie Taweel, anything else that you want to add that you're seeing or that you want people to know before we let you go here today?
Yeah, actually, just real quick, my opinion is that schools are going to start up again. People are going to start going out and mingling more, and things are going to start picking up. So with that, please, I would implore the people to not take with them this kind of, relaxed attitude that things are okay now that we're doing these things, but still just remain as vigilant as possible about maintaining social distancing, making sure you're wearing your masks, using the sanitizers, and doing all of those important things that we've been doing for so long. Everybody's been doing a great job, and I know everyone hates the masks. If I had a nickel for every time someone told me they hated wearing a mask, I'd probably have enough money to fund my own vaccine. But I get it, and everybody's just being a great sport about it, for lack of a better word. They're doing the best they can. Keep it up. Where I think this is the home stretch, and I have a feeling I'm hopeful that there will be a vaccine sometime at the beginning of next year, and I think we can just hold this off long enough and finally just avoid a lot of unnecessary deaths. Quite frankly. Thank you for.
But even when we get a vaccine, it's still going to be probably how many months after that before it's widely available to the public. So we could be in this for what, at least another 6-8 months?
Yeah, actually, unfortunately, yeah. What's going to happen is they're going to, getting the vaccine mass produced. So getting the vaccine working is one thing, but then getting it out to the public and mass produced is certainly going to be another thing. And then once that happens, they're going to really prioritize who gets the vaccine first based on order of risk. I imagine healthcare workers will get it first because they're the ones that are the highest exposed, followed then by probably nursing home occupants, things like that, and then it just kind of goes down the road. But I think once the vaccine hits, I have no doubt in my mind that companies will really, really push to get it out there so that, obviously they can inoculate the society as quickly as possible and everybody will do a lot better. But there's going to be a delay. So, there's going to be a significant time frame between announcement of a vaccine and, you being able to go to your local wherever and get it injected. So it's going to be a bit, but I think they're going to move swift. I mean, I think we're all aware of how important this is. So hopefully we can get some improvement.
So get used to those masks.
I think it's going to be one of those things where people are going to wear it even after this for a period of time. Some of them will, not all of them certainly, but I think there are going to be people that just have been impacted by this to a degree. I mean, my thoughts.
I really should have gone into the mask business. Dr. Jamie Taweel with us he is the internal medicine specialist at Grand River Medical Associates. If you are looking for a new doctor, a great doctor, go over and visit him and his staff. Always so knowledgeable. We appreciate your time here on the Oakland County MegaCast.